Good evening, everybody. There's some new faces here. We're happy to have you. For those of you that don't know who I am, my name is Dr. Holly Carling. I'm a doctor of Oriental Medicine, a licensed acupuncturist, a doctor of naturopathy, clinical nutritionist, and master herbologist. I've been in practice now for 43 years. And if you've never been to my class before, I like an open kind of concept. If you guys have a question, feel free to ask me. If you could ask loud, because we are on Zoom, and hello everybody on Zoom. There's a lot of participants on Zoom too, so if you can say it loudly, or if you don't, I'll just try to repeat it. Hopefully remember to repeat it before I answer you. But I will get back on track, so you're welcome to ask any questions. I don't want you to sit back there and feel like you're not allowed to do anything. So let me just find this really quick. Okay, I think we're good. So one of the most important things, if you take nothing else away from this class today, as we're talking about autoimmune diseases, and you know, the title is battling autoimmune diseases, and I hate to look at it as a battle because it just sounds fierce and all this stuff going on. But if you take nothing else away, I want you to understand that an autoimmune disease is not a disease that just suddenly happens to you. An autoimmune disease is another disease, usually the same one, that has progressed to an autoimmune phase. So it's just a worsening of an existing problem. It may not have come to your awareness. You have to be very far along in the kind of breakdown process before you actually start having symptoms. And so it is not that there's so many autoimmune diseases. It's that there's so many diseases that are now reaching that autoimmune phase. Mm-hmm. So I want to talk about, we have a lot of autoimmune diseases. And I'm just going to briefly go through these lists because I'm not going to list everything here, but it's pretty much in alphabetical order. There is, as we go through this, in this particular list, there's about 153 autoimmune diseases. About 2 or 3 years ago, they said that number's gone up to 200, and now I think it's like in the 400 or 500 range. So our autoimmune diseases are not only a progressive disease within itself, but the amount of conditions that are becoming autoimmune are getting higher and higher. And so we have to start asking ourselves, what's going on? What is changing that all of a sudden this is exploding? And that's part of what we're going to talk about tonight. And more importantly, things that you can do that can help mitigate a lot of what's going on with your autoimmune condition. How many of you believe that once you have an autoimmune disease, you're stuck with it for life? Nobody? I'm very happy to hear that, because there is a lot you can do to change that. So I'm really glad to hear that. Okay, so I want to talk about the more recent understanding of autoimmune diseases. And I say recent, but some of these articles go back a little way, but we have been taught that an autoimmune disease is the autoantibodies, which is what we're going to talk about, decides one day it's going to attack itself. It's going to attack healthy tissue, and that it is this force against us. And it really isn't. And so some of the beginning is going to be a little bit boring because I'm going to read some of this, but I want you to kind of understand the concept that's underlying autoimmune diseases, because then it helps give you more tools and more understanding of what we can do to combat it. So first of all, this is an article from the Annals of the New York Academy of Sciences, and it's in the issue entitled Clearance of Dying Cells in Healthy and Diseased Immune Systems. This particular article is referred to as apoptosis and autoimmune diseases. It says every day, billions of cells die in our body to eliminate those that are harmful, useless, or senescent. So what's senescent mean? It's the same thing as dementia. Basically, your cells become old and they don't perform like they're supposed to. The process can be divided into 2 steps: cell dying and cell clearance. In the first step, death machinery is activated in the cells and quickly kills them. During the second step, the dead cells are engulfed by phagocytes and their components are degraded in the lysosomes of phagocytes. And then they start talking about some of the study itself, and they're using mouse lines, and it says data from these mutant mice and human patients indicate that defects in cell death or cell clearance, dead cell clearance, is some of the things that lead to autoimmunity. And then it goes on to talk about the cells responsible for clearing the dead cells and nuclei are mainly professional phagocytes. So phagocytes are like little Pac-Man that go in and gobble up dead and damaged tissue, such as macrophages and immature dendritic cells. And as soon as cells undergo apoptosis, so apoptosis, you'll see this a couple times in class, is pre-programmed cell death. So every cell in your body has a life expectancy. And at the end of that life expectancy, and it's different for different cells, it basically combusts itself. The body takes some of the materials and reconstructs other cells, and other ones are eliminated. So apoptosis is a normal process of cell death. And different cells, like your skin cells, go through apoptosis about every 28 days. Your blood and most of your organs take about 90 days. Your harder tissues, like your tendons and ligaments and your joint tissues, take about a year. And your brain cells and your bones take about 7 years. And in all cases, it's because they get weakened. And, let's face it, as we get older as people, we don't have quite the vitality. We don't quite, catch up with things. Maybe our memories are going. Maybe we're not as strong. And it's the same way with the cells in the body. So the body has a method of getting rid of the old cells so your body can replace them. And that's what apoptosis is. So as soon as cells undergo apoptosis, the macrophages approach the dead cells, recognize them as dead, and engulf them, but they do not engulf healthy living cells. So we'll talk about why, because that's what we're being told it does, suggesting that the apoptotic cells present an eat me signal to the phagocytes. Okay, we're going to read a few of these. So what is an autoantibody? If you have an autoimmune disease, you probably have heard them talk about the autoantibodies. An autoantibody is an antibody which is a type of protein that seems to be directed against the body's own tissue or protein of that tissue. Seems to is the operative word. Antibodies that react with self molecules, for those that are in Zoom, this is an article in Nature and Functions, or an article entitled Nature and Functions of Autoantibodies, and it's in the NIH National Library of Medicine. Antibodies that react with self molecules occur in healthy individuals and are referred to as natural antibodies or autoantibodies. They provide a first line of defense against infections, probably serve housekeeping functions, and contribute to the homeostasis, or the balance of the immune system. Cell clearance or antigen receptor signaling or cell effector functions are disturbed. In some autoimmune disorders, autoantibodies may be present before disease onset. Now, I'm talking about disease diagnosis, but also disease onset. And we'll talk about that. We're going to talk a little bit about post-concussive syndrome and some other things, but you'll see where these are showing up sometimes even before you have the symptoms. So they might be present before disease onset, show remarkable specificity, and serve as biomarkers, providing an opportunity for diagnosis and therapeutic intervention. So autoantibody signatures, progress and perspectives for early cancer detection. This is in the Journal of Cellular and Molecular Medicine. This is in 2011. In patients with cancer and no signs of overt metastasis, sensitive methods have been developed to identify circulating autoantibodies and their antigen counterpart in several cancers. The autoantibody signatures seem to be particularly relevant for early detection of cancer in high-risk cancer patients. So the body is doing something, and I'm going to give you a few examples in just a little bit early on that kind of says, hey, something's going on here. If we can handle it at that phase, even before that phase, then there's a lot more that we can do to prevent it. So here's another one, autoantibodies as predictors of disease. Virtually all autoimmune diseases are associated with circulating autoantibodies, which bind self-protein. Furthermore, for many diseases, these autoantibodies are found in serum samples many years before the disease onset. I'm not going to read that next section. That's just a little too long. In the Journal of Autoimmunity, Antigenic Challenge of Etiology of Autoimmune Disease in Women, infection has long been implicated as a trigger for autoimmune disease. So this is going to make more sense as we get through the class. So I think that's pretty much done with my reading. So I just kind of wanted to set that framework up as we talk about things tonight. So when you look at what systems are prone to autoimmune insults, there's hardly any part of the body that isn't. And the brain, the spinal cord, eyes, mouth, parotid gland, esophagus, thyroid, blood vessels, lungs, heart, liver, stomach, kidneys, large intestines, pancreas, small intestines, uterus, blood, nerves, ovaries, prostate, vagina, joints, and skin. I mean, it's like pretty much everything we have found autoimmune diseases against. So this is becoming a big issue. As we talk about this, there's a lot of different organs of our immune system, and all of them have just a little bit different way that they handle things. Unfortunately, when you have an autoimmune disease, a lot of the medications that you take actually suppresses your immune system as a whole, and you may not need just the whole thing suppressed, but maybe just a certain area. But even then, we'll talk about that, may not be such a good idea. So your first line of defense is your tonsils, your adenoids, and your thyroid. Anything that's coming out here is your first line of defense. What happens if you've had your tonsils and adenoids taken out? You've just handicapped part of your immune system, right? They actually can tell you right off the bat. If you have a bacterial infection, you'll have a swollen uvula. That's that little thing that dangles down in the back of your throat. You might have whitish spots. You might have red and swollen tonsils, throat redness, and a gray or a furry tongue. In a viral infection, you may have red and swollen tonsils as well, and throat redness, but not generally the spots or the indicators of an infection. Well, let's see if this will work for us tonight. It does. So when you look at this image, there's a little protein that slips into the bloodstream, okay? So this is damaged. Here's your normal bloodstream, little blood cells going in, and all of a sudden, here's this foreign thing that enters the bloodstream. How the immune system works is when you have an organ, let's say the thyroid, and the thyroid is damaged, it is going to leak damaged thyroid tissue into the bloodstream, okay? Just like we saw in this image. That didn't look like a thyroid, I don't think it did, but it leaks into the bloodstream, and your immune system says, oh, this doesn't belong in the bloodstream, we've got to clear it out. And that's the normal function of the immune system, get in and clear it out. But then more and more leaks and more leaks and more leaks. And the immune system starts to get worn out. As we progress, you'll see what happens in that. So to the rescue in that sense is a lot of different cells. You have eosinophils, you have basophils, neutrophils, monocytes, erythrocytes, myeloid progenitor cells, platelets. All of these are aspects of the immune system that may come into play depending on the kind of insult, the kind of injury that's occurring. And basically what's happening is, how many of you remember the old Pac-Man? It goes in there, it gobbles up that tissue, it engulfs the tissue and breaks it down and clears it out of the system. It's supposed to do that. We're not going to get real involved with each of these because it can get too complex and it'll take us beyond what I want to talk about tonight. But our body is actively always going through here. Here's another example, if this will work. There's a phagocyte. It grabs that bacteria and engulfs it. Do you see that? We'll do it again. There's our little red guy, gets engulfed, and within that mechanism, it gets broken down. So let's talk about the different organs and how they affect the immune system. So the spleen is a functionally diverse organ with active roles in immunosurveillance and hematopoiesis. So the three functions of the spleen is that it clears the microorganisms and antigens away from the bloodstream. And antigens are produced when you eat something that your body disagrees with, or there's an inflammatory response. It synthesized immunoglobulin or IgG and some other compounds that help with the immune response, and then it removes and produces red blood cells. Okay, so it has some kind of diverse functions. Like all organs in the body, if the spleen is not fed what it needs to function properly, it's not going to function properly. But there's one thing that's unique about the spleen than any of the other, well, there's several things, but any of the other immune functions is the spleen doesn't like cold. If you're eating ice or ice cold water, the stomach is sitting right next to the spleen, and the spleen tends to get too cold and it weakens its function. So one of the first things that you can stop doing is if you're eating ice or you're drinking ice cold water, stop doing that. The stomach also doesn't like cold and ice, and you weaken your digestive function as well. So those are two things that if they're in your diet that are easy to get rid of. And you might have to transition from ice water to cold water to cool water to room temperature as you get used to it. But for some people, it's really not that big of a deal. They both, however, really enjoy warm. So it would be better to have a warm cup of tea than it would to have a cool glass of water. That's not to say I do want you drinking a lot of water. Okay. And we'll talk about that when we get to that section. Yes. Then your immune system's been handicapped.
Right.
So
the three functions.
Well, you're lucky that we have backup systems. Okay. So when you come to the functions like making red blood cells, your bone marrow also makes red blood cells. As far as clearance of microorganisms and antigens, your thymus gland helps with that. Synthesis of IgG, immunoglobulin G. I have to think about that, but there is another system that's involved. We have an amazing designer to our body that has backup systems. Just like getting your tonsils and your adenoids out, you've lost that line of defense, but you still have other lines of defense that just now they have more stress put on them. So people can survive without the spleen because of that. The spleen also acts as a blood filter and controls the amount of red blood cells and blood storage in the body and helps to fight infection. It detects potentially dangerous bacteria, viruses, or other microorganisms in the blood. And it, along with the lymph nodes, which is governed by the thymus gland, creates blood cells called lymphocytes, which act as defenders against the invaders. And this is according to the U.S. National Library of Medicine. The lymphocytes produce antibodies to kill the foreign microorganisms and stop infections from spreading. So it's a pretty important. Anytime you can possibly help it, don't have anything taken out. Okay. There's two different things that we use to help strengthen the spleen. One is called spleen PMG. A PMG is a protomorphogen. I will be explaining what that means in a little while. And then also desiccated spleen. And it depends on what's going on with your spleen, how we support it. We use a lot of supplements from a company called Standard Process. And we use it. Standard Process is the only one who makes PMGs. It's the only place you can get a PMG is short for protomorphogen. And And it is critical when it comes to autoimmune diseases, as you see as we progress. And spleen desiccated is basically the spleen of another animal, usually a cow, sometimes a pig that's chopped up and desiccated. It has all the enzymes, all the proteins, all the hormones, everything that is needed to help rebuild an organ. And we have, desiccated spleen and desiccated adrenal and desiccated a lot of different organs. So the next is the lymphatic system. The lymphatic system contains a high number of lymphocytes, the white blood cells that fight infection. The lymph is unique in that there's nothing that propels it. In the bloodstream, we have microscopic muscles that help propel blood, as well as heart movement, as well as diaphragmatic movement. So as you're breathing, you're moving your blood. The lymphatic system doesn't have that. The best way to activate the lymphatic system is through massage, through a rebounder. Have any of you ever used a rebounder? So a rebounder is a mini trampoline. And there's something about that negative gravitational snap that gets that lymphatic system moving. The other thing that gets the lymphatic system moving is bending and standing. So like you're collecting logs or you're doing something like that, that bending of the body and straightening back out also helps to move the lymphatic system. So if you're never doing things like that, if you're never actively, picking up toys, a good reason to pick up toys around your house, right? So that helps the lymphatic system. The problem with the lymphatic system, and especially in an autoimmune disease, is that it's taking away waste material. It's taking away dead cells. Well, in an autoimmune system, you have a lot more dead cells that are having to be removed. If you're not drinking enough water or doing something to propel the lymphatic system, it gets sluggish. It starts getting, the lymph gets thick and gooey and doesn't move like it's supposed to. So who here knows how much water you're supposed to drink? Anybody? How much?
Glasses.
Okay, so let's think about, do children have autoimmune diseases? So he said 8 glasses. They do. Do you think a child can drink 8 glasses? So that's what we've been told for decades, right? But it's not universal. A proper amount is half your body weight in ounces per day. So a child that's only 60 pounds is only going to drink 30 ounces. They're not going to drink 8 glasses because that would actually wash out their minerals. And this is really important. If you drink too much water, you're washing out your minerals. You can actually die from drinking too much water. But you can also die by not drinking enough. So half your weight in ounces per day is how much you should be drinking. You have got to wash that stuff out and get it cleared as quick as possible so your immune system can be functioning a lot faster. Okay. So I have an image here of the lymphatic system. This is brief. There's actually a lot more lymph in the body, but it gives you an idea of where the concentration of lymph is. Another thing that's helpful for the lymphatic system that's not on this list is dry skin brushing. How many of you have ever heard of that before? So most of you have. Good. So the key to dry skin brushing, if you've never done it before, is you have to do it in dry skin. If you try to brush your skin when you get out of the shower, you're going to take off too deep of a layer of skin. It has to be like before you get in a shower. So when the skin is very dry, you take a brush and you are brushing toward the heart. Okay. Always toward the heart. When you're on the legs, you're going to bring it up to the heart. When you're doing the arms, when you're doing up in your traps, you're going to bring it down to the heart. Always toward the heart. And it's one swipe. It is not a scrubbing. It's one swipe to the heart only. And that is really good for moving lymph as well. And this is something you could do every day. The lymphatic dry skin brushing connoisseurs. So you should only use a natural bristle brush, like a boar bristle brush. And I do have one. It is by far the best, but they can be pricey sometimes. They used to use what is well, they use sisal. What's the other one? The sea sponge, a loofah. But loofahs are really scratchy. And I think the easiest to use, although it defies all the dry skin brushing connoisseurs, is those bath gloves, because you can form it around your arm and just do that. And it's just a lot easier, but it's a synthetic. And that's why they don't really like it. But it does work well. And it's easy in bumpy places like fingers and things like that. But I do like the boar bristle brushes. They are much better. And I think they're more stimulating as well. So one of the other things that congests the lymphatic system is when your cells are breaking down faster than they should. So if you've got cells that are supposed to break down every 90 days, but they're breaking down every 80 days, then you're going to have more of an accumulation of waste than what the lymphatic system was designed for. So if you're breaking down faster than the lymphatic system can keep up with, then you are likely to have some problems with your lymphatic system. Toxicity, it's trying to get rid of toxins. One of the best things you can do for the lymphatic system is do a detox, and do one that includes lymphatic. But you have to do it in the right timing, especially with autoimmune diseases, because you've got so much going on that if you don't do it in the right timing, you're going to end up sick. And I don't like making people sick. I like making them well. And so I know what the timing is. There's a proper timing, and it's different for everybody and every different autoimmune disease there is. So doing a detox is very, very helpful in this. How we typically treat it, we do a 10-day program that's a lymphatic flush, and then we do a thymus PMG, which moves your lymphatic system, or a Thymex, which is working deeper on a cellular level. Again, this is a protomorphogen, and I hate to keep talking about protomorphogens, but not telling you what it means until we get to that spot. So sorry about that. So let's talk about the thymus gland. The thymus gland is responsible for clearing. It's one of the important parts of the immune system. And one of the things that we do for the immune system, how many of you have heard that you shouldn't take an immune remedy for a long period of time because your body gets used to it and it adapts to it and no longer works, right? A lot of us have heard that, and that is true. Some things like golden seal are more prone to that. You should never take golden seal more than a couple of weeks because it'll no longer work in your body because your body adapt. They used to say that about echinacea, and now the research is the opposite. The more you have echinacea in your body when you need it, it works even better. And it is one of the good long-term ones. However, I don't even like to use echinacea long-term. Sometimes I do, depending on the situation. I like to do an immune rotation, where we take a different herb or a different substance every week. We do 4 of them, and then we rotate it. So 1 week, it targets the thymus. The next week, it targets the spleen. The next week, it targets the bone marrow. Another week, it's the whole system altogether. And then you go back through that again. So you're only taking it a week. You're stimulating or strengthening. Actually, the ones that we do are to strengthen the proper function of your immune system. And you do just before the body gets used to it, you're moving on to another system. So you keep strengthening, but your body doesn't get adapted to it. And so doing an immune rotation is a really nice way to gently give your immune system the strength it needs. There's also for the thymus, there's what's called a thymus rub or a thymus tap. So the thymus gland is located on the sternum, right in the center of your chest here. And you can either tap it, or some people aggressively rub it, and that helps to stimulate its function. And again, you have people that's all they focus on. People who are real connoisseurs of it say you should do it in the sunshine. I say just do it wherever you can do it. When you think about it, if you can do it in the sunshine, that's perfect. But if not, to do that every day to just kind of stimulate it. By the way, when you know how colds usually last 7 to 10 days? Do you know why? Because it takes 7 to 10 days before your thymus gland goes, hey, I got a problem here I need to start handling. If you start stimulating your thymus gland, it handles it a lot quicker. You get over your cold quicker. Okay. Actually, you should have a cold at least 1 or 2 times a year because it's the body's way of cleaning the lungs out. And if you don't, when people come in and say, oh, I never have a cold, I think, oh boy, we live in an environment that has a lot of pollutants, and the house is the most polluted environment we can live in. And if you're not having a cold and not cleaning out your lungs, then your immune system is not working as well as it should be. However, this cold should only last 24 hours. Okay. If your immune system is working properly, cleans it out, it's done. 24 hours later, you may or may not have a fever. If you have a fever, it's because your calcium levels are too low to do what it needs to do. So you should not have a fever. It should just be a cleaning out. Everything flushes. You're done in 24, maximum 48 hours when you have a cold. Okay. I'd love to get everybody's immune system to that point. The thymus isn't necessarily, it is, like I said, one of the first lines of a defense against viral or bacterial infection that comes in through your respiratory system or through your mouth. But the thymus also has a tendency to have an autoimmune disease, right? Everybody knows that, right? Hashimoto's. Okay. So I want to explain that. I said I was going to get to this, and I am getting to it, except I'm going to check something real well. Going the wrong way. Hold on a second. Okay. So I was talking about how when you have a thyroid, and I was using that as an example, and those thyroid cells are leaking into the bloodstream, and your immune system has to attack them. And I was looking for some other notes. Hold on just a second. I'm just going to pop ahead really quickly here. Way too far ahead. So we're going to talk about it right now. Getting a hint of what things we're going to be talking about. Okay. So the best way that I like to explain this is, let's say that you came home one day and your kitchen was flooded and you realized you left the kitchen faucet running. And you go to work and you're throwing towels on the water and using your shop vac, maybe using a mop, whatever you can to soak up the water. That's what you're going to do as soon as you get there, right? But you've left the faucet running. What's going to happen? You're going to get exhausted. You're not going to be able to keep up with it until you go to the source and turn the source off. You're not going to be able to get it under control. This is what happens in an autoimmune disease. All of these cells are spilling into the bloodstream. The immune system keeps handling it and handling it and handling it. Pretty soon it gets exhausted. It can't do it anymore. And it says, I got to go for the source. If that's the thyroid, it's going to try to shut down the thyroid. Okay. If it is your joints, it's going to try to seal that up and stop that process. It's got to go to the source and stop it from happening. That is what an autoimmune disease is. It's not that the body just arbitrarily says, I have nothing else to do. Let's attack healthy tissue. It's trying to stop the source from being infected. What a protomorphogen does, and I'll get to this a little bit later, but I just feel like we need to do it right now, is it works as a decoy to pull your immune system away from whatever that source it's after. Right now, we're talking about thyroid, to pull it away from the source so we can go in there and heal that damage. So there is nothing else in the market that does that. And with all autoimmune diseases, we have to do PMGs in order to take that pressure off the body and to get that immune system to just shut down not shut down, to get away from the source so that we can heal the source tissue. Okay. In the case of the thyroid, so Hashimoto's thyroiditis is an autoimmune condition that's the common cause of hypothyroidism. In Hashimoto's thyroiditis, the body mounts an immune reaction against its own thyroid gland tissue, leading to the inflammation of the gland. Again, it's trying to shut it down. all hyperthyroidism starts with hypothyroidism. Does that make sense? So people say, well, sometimes I'm hyper and sometimes I'm hypo. So sometimes it's overactive, sometimes it's underactive. What'll happen is your thyroid gets lower and lower and lower and lower until finally it's like, if you're out in the ocean and you're starting to drown, are you going to put your hands to your side and just sink? Or are you going to pedal as fast as you can to keep your head above water? This is what happens with the thyroid, is it starts over responding, trying to stay in function, and it goes hyper. Unfortunately, in conventional medicine, they go, oh, it's hyper, it's too active, let's shut it down. And they give you radiation, or they do something to shut your thyroid down. Sometimes they remove part of it. And then it's like, oh, sorry, but now it's hypo. You need to be on medication the rest of your life. I had a case in town one time where a patient I hadn't seen for many years came to me and said, I suddenly have a hyperthyroid, and in 1 month, I'm scheduled to have it removed. You've got 1 month to make me well. And I'm like, oh, okay. That's like, putting the feet to the fire. And I'm like, you've got to do everything I tell you to do. And she did. And so a month later, she went in for her pre-op labs, and it showed her one number under normal, just a tiny bit of hypothyroid. And I told her, you're going to go from hyper to hypo to normal. And so that's what the lab showed. It was 1 point away from 1 point hypo. And when she went to the doctor's office, the endocrinologist completely lost it, started screaming at her and said, what did you do? And she said, well, I went to an acupuncturist. I started taking supplements. I started doing things with my diet. And she says, how dare you circumvent my care and do something to heal your thyroid? We can't do the surgery right now anymore. You have ruined it. We cannot do your surgery. And she just went off on her for like 15 minutes about how dare she try to do something different to save her thyroid. And the patient's just kind of like staring at her. And then she writes on the notes, I never want to see this patient again. Went to the front desk, slammed it on the counter and said, I never want to see this patient again, and walked out of the room. And she just sat there for a minute. She didn't even know what to think. But we came back and continued to handle it. She never had any thyroid issues again. We were able to save that thyroid, which was awesome, but not awesome for the doctor. She was not very happy. So thyroid function, we have to ask, if your thyroid is having problems, why is it having problems? Okay. We talked about why the lymphatic system might get congested. So there's a lot of things that can affect the thyroid. And unfortunately, when they do labs, they tend to only do TSH, or maybe they'll do a little bit of T3, T4. But if you don't do a whole panel, you don't know if the thyroid issue is a pituitary issue. You don't know if it's a thyroid. It could be the adrenal glands. It could be the liver isn't conjugating hormones. And when you have just a partial panel, you'll never figure out what's wrong with the thyroid. And if you don't do an autoantibody test on it, I can't tell you how many patients had all the symptoms of having a thyroid problem. And you look at the labs and it's like, well, TSH, T3, T4 are normal. And I'll go ahead and run some more. And their TPO, their thyroid peroxidase test, comes back that they have a really high levels of autoantibodies that are going against their thyroid. But the labs showed that they were okay. You have to have whole panels done. And unfortunately, a lot of doctors don't want to do that. I don't know why. It shouldn't be any big deal to them, but they don't want to do that. And so, and especially if they show up with high antibodies, but normal rest of their labs, they don't know what to do either. And so there's a lot of things that we can do. One of the other things that I'm starting to read a little bit about thyroid is, especially in women, but men too, the lotions that we put down on our neck absorb into everything that's here. And many of our lotions have a lot of chemicals in them. Men are using aftershave, or they're using shaving cream and they have chemicals in them. And so I'm starting to see, and I wondered about this a number of years ago, quite a few years ago. And it's only just now that we're starting to see, well, maybe there's really something to that. So if you're going to use a face lotion or cream or something like that, check your ingredients. Anything that goes in your skin is going to get absorbed directly into the bloodstream and whatever's behind it. So as you're putting stuff on your neck, be really cautious with that. The treatments that we use, iodine, let's talk about iodine. Every organ in the body has a mineral that it's dependent on for function. The mineral that's needed for the thyroid gland is iodine. And with iodized salt, we pretty much have gotten rid of, but not entirely, goiter. We still see goiter, but we've replaced it with an autoimmune thyroid condition. And the reason why is because iodized salt is potassium iodide, not iodine. You need potassium iodide and iodine and a protein bond in order to get it into the thyroid. Certain things like seaweed already has it all together, but the way they have done iodized salt, it doesn't. And so now we're getting autoimmune diseases if we're consuming iodized salt. So your best kind of salts are salts that have color, like Himalayan pink salt or Hawaiian black salt. Your sea salt has been highly processed. There's no color left to it. So my favorite is Redmond's real salt. But there's a lot of different ones. As long as they have color, those are going to be good salts for you. Okay. And you do need it. There is a point with hyperthyroid that you can actually make it worse with iodine. So you really need to know what you're doing. I wouldn't recommend you guys just go out and get iodine. You need to make sure that you're working with a practitioner that understands the proper timing, the proper dosing, and what else should go with it. We use also a thyroid PMG, a thyroid protomorphogen, again, to take that immune system away from the thyroid so we can go in and heal it. Thyroid complex is another one that we use, but we use that. We don't use that with hyperthyroid. We use it more for a hypo. So the other thing we have to look at is a liver overload. Most of your autoimmune diseases, you also have a liver overload. The liver is not handling things properly. Our liver was designed to handle the toxins that we've experienced for thousands of years until the last couple hundred years. It wasn't designed to handle the toxic load that we have today that is so much greater than we've ever had in the history of man, and very tough things to break down. And so the liver gets overloaded. We have so many medications, whether they're oral or topical or injectables or troches. There's all kinds of different forms. They overload the system. We have environmental toxins like plastics and rubbers and resins, pesticides, herbicides, fungicides, cleaning solutions, coloring agents. Air fresheners is one of the worst things in your house, especially the kind that you plug into a wall, where it's warming it and it's really getting it into the atmosphere 24/7. Those are very toxic. They're considered xenohormones, which means they actually mimic your hormones. They get into the hormone receptor sites and they create a lot of problems with your hormones. Okay. Excess alcohol consumption, rubbing in isopropyl alcohol. You guys know what that is, right? Not the kind you drink. Your skin absorbs it. Your liver absorbs it, and the liver never gets rid of it. They have found people who have never had an alcoholic beverage in their life with liver cirrhosis. And they found they got it because they were using rubbing alcohol a lot. Yeah.
So over the last 2.5 years, when alcohol to clean,
Sanitizing.
that's especially if you're in healthcare like I am,
Mm-hmm.
it's probably really bad.
Yes, it is really bad.
Hand sanitizers are all.
Hand sanitizers, all those alcohol cleaning solutions, you're absolutely right. We have been doing that in excess in the last couple of years. And so the liver's absorbing that. And diabetics that are always swabbing.
I just want to ask you questions. I go to meetings at the Alano Hall sometimes, and they have these dispensers of real toxic alcohol that's supposed to kill germs and stuff. And it stings a little bit. And so you put it on your hands and you can actually feel that. So what you're saying, that can be absorbed right into the liver?
Yep.
Oh, okay. I'm going to do that again.
So yeah, either don't use it or bring your own.
Yeah.
And that's what I did during this whole thing is I brought my own essential oils, sprayed it or sometimes dropped it. And those work. They know that rubbing alcohol does not kill bacteria. They know it. They've known it for a long time. And yet they keep pushing it. They keep pushing it in the schools for kids to have it at their desks. And I wrote quite a letter to my grandson's teacher at one time when he was young, and they were saying he had to bring hand sanitizer. I'm like, there is no way. And so we brought his own stuff, and I think they pretty much left him alone after that.
So what do you recommend instead of that?
Well, there's a lot of essential oil companies who have made hand sanitizers, especially in the last couple of years. If they weren't doing it before, they sure did in the last couple of years. I like doTERRA's On Guard spray.
Okay.
Young Living has one that is called Thieves, and I like both of those. But there's lots of them out there that you can use that don't have alcohol added to them, or a very minor amount. With liver overload, if you don't have good circulation, you have to have blood circulating through the liver. And this is one of the things that's really important about aerobic exercise. More than anything else, the way that blood gets moved through your liver when you're exercising is really, really important. And an overloaded liver, you're more likely to have an autoimmune disorder. So take care of your liver, do some detoxification, give it a break as much as you possibly can. And also the liver needs certain minerals and fats. And if it doesn't get it, it doesn't function as it's supposed to either. And we have whole classes just on liver and gallbladder. So I'm trying to keep that as basic so we keep to the topic at hand. Okay, the liver has, depending on who is categorizing it, between 600 and 4,000 functions. They're now saying that the liver is likely responsible for every single metabolic reaction in the body, either directly or immediately indirectly. You know, how many of you have seen a liver, like an animal or something like that? It's kind of a plain looking thing. There's nothing exciting about it. It just looks uniform. And I look at that and I look at the heart, and the heart is so extensive with so many vessels and chordae and valves, and it's so elaborate. And the only thing it does is pump. And then you get this liver that just looks like a boring blob of meat, and it has a tremendous amount of function in the body. I just think that's really interesting. The liver does help with the immune function. And so that is one, and it helps with immune function on a lot of different levels. And so that is really important. There's several things that we do. Again, here's another PMG, another protomorphogen for taking stress away from, or taking the immune system away from pounding on the liver. We also use Liviplex to build the liver, or silymarin, which is milk thistle, which helps to protect the liver. I generally advise my patients not to consume alcohol. Alcohol is very destructive to the body on so many different levels. And one of the things it does is it robs your minerals and it robs your B vitamins. And so we have a protocol with our patients that if they're going to, even though I don't want them to, drink something, then we have what we call alcohol packets. And it's not the rubbing alcohol packets, but we give them a packet that has B vitamins, minerals, and milk thistle to protect the liver from the insult from the alcohol. At the same time, we're trying to get it to take the minerals that you just consumed rather than steal it out of your bones and out of your tissues. And so we have them take a packet before they go out drinking and another one when they're done. And we have noticed that people do so much better in their recovery. If they drink too much, is so much better as well.
other body parts there with the liver. Mhm.
Oh, the other body parts that are with there.
Yeah.
The little green thing that's hanging down from the liver that's that's actually tucked up in there, that's your gallbladder.
Mhm.
And then the vessel is a common bile duct. The yellow that you see, that yellow tail, that's the pancreas. And the little white thing that's hanging down is actually part of the intestines. It's the duodenum. And the pancreas and the duodenum the pancreas and the gallbladder secrete their enzymes into the upper end of the small intestines, the duodenum, which is what that white curvy thing is. So they're all part of the same mechanism. And if one is having a problem, a lot of times the others get involved too. So we usually try to treat them as a group whenever possible. That was a great question. I didn't even think about that when all that it was in there. Okay. Autoimmune heart disease. So autoimmune diseases such as psoriasis, lupus, and rheumatoid arthritis more than double the risk of cardiovascular disease. A new study shows that immune cells that arise during autoimmune disease cause cholesterol to become trapped inside the blood vessels. I'm looking for the source. I put November 8, 2018, and I can't find that source. It goes on to say autoimmune heart diseases are the effects of the body's own immune defense system mistaking cardiac antigens as foreign and attacking them, leading to inflammation. We know that that is not true now. It's because the heart is damaged and it's sending out damaged cells into the bloodstream, and the immune system is trying to stop that. Rheumatic heart disease, autoimmune. It used to be, I remember when we were first talking, when autoimmune diseases were really starting to get some recognition, they always said, well, it'll never affect the heart. And, but it does. And rheumatic heart disease is considered that as well. But I have a son who has many congenital heart defects. And he had gone for heart surgery, and he came back from his surgery, and within days, he had rheumatoid arthritis at 18 years old in every single joint. And I mean, they were swollen, huge, and red. He couldn't walk. I mean, he couldn't even go to the bathroom. He couldn't feed himself. He became an invalid within a couple of days of coming home after his heart surgery. And he came home 48 hours after his heart surgery. And just this instant rheumatic arthritis kind of condition. And I felt so bad for him because 4 weeks later, he was scheduled to start college for the first time. And I literally took him to college in a wheelchair because they said they would not let him withdraw until he at least was at school for 2 weeks. And I'm like, you might have to just get through for 2 weeks. And I was doing everything. I was doing acupuncture, throwing everything at him. And the night that we brought him to school in his wheelchair, which was very embarrassing for him, it just disappeared just like that. And he's never had any problems since. But it was just a really interesting look at how things like that can happen in the body and you don't even know. But fortunately, he got to put his wheelchair away and never had to use it the rest of the school year. I mean, it was gone. I mean, he was still weak from his heart surgery. And the poor guy had to walk from one end of the campus to the other. I had to do his schedule because he was in the hospital during the time. He only had one registration date and he had to register, and he had just had heart surgery. So I had to register him, and I thought, oh, there's the shuttle. I'll just make sure all his classes are close to the shuttle so that it would be easy and he wouldn't have to walk. Well, after he started school, we discovered the shuttle wasn't working yet. It was still under construction. And so his classes were like one end of San Diego State University to the other. Just boom, boom. But he made it. Never had to quit school. And so, poor guy. So the heart can be involved as well. Rheumatic heart disease, inflammation from rheumatic fever that damages heart valves, endocarditis, which is an inflammation of the inner heart walls and valves, or myocarditis, which is inflammation of the heart muscle. Pericarditis is inflammation of the sac that surrounds the heart. A lot of people don't realize they have a sac around the heart. It keeps from all the rubbing down the heart. Coronary artery disease, there's damage to the coronary arteries that are around the heart. resulting in cholesterol buildup and narrowing of the arteries. So not just around the heart, but throughout the body. And injury to the heart in any way that doesn't heal properly can lead to an autoimmune heart disorder.
Question for you. Can that be reversed? All these things that you're talking about?
Yes. And that's what we're going to get into. And I'm trying to give you little things that you can do as we go along, like with the lymphatic system and doing rebounders and water and things like that. But we're going to get into a section where we nail it a little harder. Okay. And I know that's mainly what you're here for. You want to know what you can do about it, right? So, okay. So in Science Daily, in the Science News, it said there's a link between autoimmune heart disease and immune cells causing cholesterol to be trapped in blood vessels. In this short piece, it says autoimmune diseases such as psoriasis, lupus, and rheumatoid arthritis more than double the risk of cardiovascular disease. A new study shows that immune systems that arise during autoimmune disease cause cholesterol to become trapped inside blood vessels. There's a very good reason for that. One of the most important functions of cholesterol is to heal damaged tissue. So it makes sense that if you've got damage in your vascular walls, you're going to get more cholesterol to try to heal it. That is its job. So if you have damage in your vascular walls and you have microscopic cracking, which happens if you have a B vitamin deficiency, if you're using ascorbic acid, if you're drinking coffee, those are all things that can lead to microscopic cracking of the vascular walls. The liver or the body sends a message to the liver to get cholesterol. So the LDLs go and grab the cholesterol and they plaster it inside the walls of the arteries so that it can heal it. When it's done, if it stays on the walls, it will start to oxidize and become what's called a peroxidase. As a peroxidase, it will now damage the walls. So it's up to the HDLs to come and take it off the walls and get rid of it. So as long as the LDLs are bringing it from the liver, putting it on the vessels, healing it, and then the HDLs pull it away, it doesn't matter as long as they're in sync, how high your cholesterol is. To stop your cholesterol from doing that job puts you at greater risk. And they're now finding that statins actually increase your risk of heart attack or stroke. Not by a lot, but enough. And so it's really important to me that we find out if you have high cholesterol, why? What is it trying to heal? Which tissue is it trying to heal? What else is going on? You need cholesterol for hormones. It could be just that you don't have enough hormones. So there's about 200 functions of cholesterol in the body. And if your cholesterol is high, we need to find out why, rather than just artificially suppressing it. You don't want it out of control because it makes your blood thicker and you have all kinds of other issues. But it is there for a purpose. Atherosclerosis is characterized by the accumulation of lipid particles, immune system cells like monocytes and macrophages and T lymphocytes, autoantibodies, autoantigens, and the multiple production of inflammatory cytokines. And we don't need to get into all the different kinds. And all these components lead to a gradual thickening of the intima layer, causing a decrease in elasticity, arterial lumen narrowing, which means your blood vessels are getting tighter, smaller in circumference, blood flow reduction, plaque rupture. And when the plaque ruptures, if it goes to the heart, you get a heart attack. If it goes to the brain, you have a stroke. And finally, a cardiovascular event. The systemic inflammatory response that characterizes atherosclerosis also involves acute phase reactants. C-reactive protein, for instance, CRP can activate. Okay, this is getting more. What I wanted to see is increased levels of CRP is shown to be independent risk factor for cardiovascular disease. So CRP shows inflammation in the arteries and vessels in the blood, and tell us if you are attending that way. Part of what happens, where does the plaquing come from? The plaquing comes from the body taking calcium and trying to shore up the damage because the cholesterol isn't doing the job. So more than not, you're getting plaquing because you have something that's stopping your cholesterol from going in and doing the job, usually statins. And so then cholesterol is like, okay, let's go in there, let's shore it up, let's tighten it up and basically cement it. And of course, then it becomes very stiff and it doesn't move very well, just like cement doesn't. Okay. Cardiovascular involvement in autoimmune disease. Atherosclerosis was once considered to be a degenerative disease that was an inevitable consequence of aging. However, researches in the last 3 decades have shown that atherosclerosis is not degenerative or inevitable. It is an autoimmune inflammatory disease associated with infectious inflammatory factors. Basically, the body is inflamed and breaking down, and your body's trying to hone it in, trying to clear it up. So let's talk about not only a heart healthy diet, but a diet that is going to help you in a case of autoimmune disease. Whenever there's autoimmunity issues, it's because there is not sufficient nutrients to help your immune system function properly and to help you to heal. So now we need to talk about what is needed for that to heal. And most of you will probably guess a lot of fresh fruits and vegetables, right? Where are we on time? I'm actually going to skip the cardiovascular weakness since this isn't a cardiovascular class per se, but we do have lots of different things, including a PMG. By the way, in my family, we have my grandmother and I was born with a heart defect. My son was born with multiple heart defects. I knew my aunt had one. I knew my grandmother had one. Finally, I'm like, what is going on with this in the family? And we were able to trace 6 generations beyond my grandmother, where every single family without fail on that line was born, had at least 1 or 2 children born with a heart defect. So we very much had the genetic propensity for it. It was always the 2nd and 3rd child. In my son's case, he was the 3rd child. But while his heart was forming, I was overexposed to radiation. I was crop dusted on with a herbicide that we now know, glyphosate, causes heart problems. And what was the other thing? Oh, we were living with sick cats that had a parasitic disease that they now tell you not to clean cat boxes when you're pregnant because it causes heart disease. And that happened. I was living with that at the same time. So during the time his heart was forming, it didn't have a chance. And that's why he has so many heart defects. The doctors told him that the chances of him having a child with a heart defect is very, very high. And so I decided with my children, just in general, because of our family history, I'm breaking this cycle. Mm-hmm. I took cardiotrophin, which is the top one up there, PMG, because a PMG is also the DNA blueprint of how function is supposed to happen. It is mandatory in my children that when they are pregnant, they have to take cardiotrophin PMG. My kids now, my cousin's kids all have heart disease. My kids do not. I have 5 grandkids now. Not a single one of them, including my son's son, does not have any heart defects. And it's because I demand this. And it's funny because my son lives in Vietnam and his wife is Vietnamese, and sometimes communication can be a little bit difficult. And when she asked to marry my son and wanted to have babies, I'm like, okay, one of the parameters are when you're pregnant, you have to take whatever I give you. And she did. And so they keep every once in a while taking their son in and checking his heart, and he has no sign of any kind of cardiovascular. So far in my line, we seem to have managed that. So I'm hoping so. But like I said, my cousins have babies that have heart defects still, in that line. And it's cardiotrophin that I use. So liver overload. We didn't talk about this much, but there's a 21-day purification as well as a 10-day program to help out your liver so it can help your whole immune system. All right. So brain, I wanted to talk about post-concussive syndrome because that is in the news a lot. You hear about these athletes who have been getting their head bashed, especially in football, and now they're getting dementia. Why is that? It's an autoimmune disease. And what's happening is their brain doesn't ever get a chance to heal. Because once the concussion is over, and sometimes even before it is, they're back out in the field getting their head bashed again. And even if they don't take a, a hard hit that you can see, just the fact that their heads are slamming back and forth every time they slam into a body, it's important that whenever somebody has a brain concussion, I have them come, we give them neurotrophin PMG, which is the PMG for the brain, so that we can help prevent this post-concussive syndrome. We have to stop the immune system from attacking the brain and ending up with Alzheimer's later on. We do a lot of work with that.
We've learned a lot about concussion over the last several years, and we know that one concussion causes a problem, but in general, people recover from a single concussion. Multiple concussions can cause problems down the line, and we've seen this in retired NFL players that have had their brains autopsied, and they show early neurodegeneration called chronic traumatic encephalopathy. Now, one of the interesting things about this process is that it looks like it's not just multiple concussions, but that it may be multiple subconcussive head blows. So blows that don't result in concussion may be the thing that's more important than concussion for producing this form of neurodegeneration.
So then he kind of goes, it takes him a long time to get into that process. It's about 15 more minutes and we don't have the time to go through that. But it's, it is the conversation right now, how this is happening. And I'm really saddened when I see kids that are out playing football because you just sit there and go, oh, but of patients that I know their kids are in football, I have them take the neurotrophin PMG to help prevent that from happening. And by the way, we use this a lot in pregnancy. We use the PMGs also to stop different defects. So like I had a patient, everybody in her family was diabetic, type 1 diabetes. They were born with diabetes or early on. We gave them pancreatrophin PMG when they're pregnant and their babies are not having these diabetic issues. We've done that to one of my patients that had arthrogryposis, which is is clubfoot is another name for it. And it's generations of bone disorders in her family. None with her kids. We give them the PMG for the bones. And so there's a lot of things we can do preventively as well with these PMGs. Okay, autoantibodies to the DNA associated with schizophrenia. I'm just going to go through several of these other autoimmune conditions because we don't have time to detail a lot of them. Moms with autoimmune diseases are more likely to have kids with autism. I am going to read this one. The identification of specific serum antibodies in mothers of children with autism that recognize prenatally expressed brain antigens suggests that these autoantibodies could cross the placenta and alter fetal brain development. So it's really, really important for if you're pregnant and you have an autoimmune disease to get that handled. Here's another one. That was Arthritis Today, where that article was. This other one, Science Direct, Elsevier is maternal anti-brain antibodies in autism. There's quite a bit of that. Brain behavior and immunity, anti-brain antibodies are associated with more severe cognitive and behavioral profiles. This was an Italian study in children with autism spectrum disorder. Here's other ones, autoantibodies. This is, what was that? The Mind Institute, UC Davis, in Davis, California. Journal of Neuroimmunology, anti-brain antibodies in children with autism. And this other one, I can't see the source. But as you can see, there's a lot of people that are looking at these autoantibodies and different brain disorders like Alzheimer's. And I don't want to go through all of these. Anti-brain antibodies in alcoholic patients. How scary is that? 40% of patients with only 6.7% and only 6.7% of controls had anti-brain antibodies. And so that's where some of the neurodegeneration occurs with alcohol. So we use this neurotrophin PMG, we use Neuroplex, and the brain requires lots and lots of B vitamins. And most B vitamins are synthetic. This one is a food source, so it actually gets into the brain better. And we already talked about the neurotrophin, so we don't need to go back through that again. The brain is everything, needs lots of good food. Here's a lot of 10-day programs that we have that are brain related, neurovascular health, brain cognition and memory, nervous system health, and emotional health. These are all 10-day brain focused programs. And again, then neurotrophin. Yes.
If you have then like a strong family history of Alzheimer's,
Mm-hmm.
that would be something
That you would take preventively.
preventative.
Yeah.
And starting it, like, for instance, I've got a strong family history, so I'm not too old to start.
No, you're not too old to start.
Yeah, I feel like I'm too late for me.
No, you want to start right now before you start having the indicators of it.
If I have autoimmune as it is.
And once you have one autoimmune disease, the chance that then you start this snowball effect. It goes to another autoimmune because your immune system's already overwhelmed. So it doesn't take much for another tissue to be involved that's injured. That's why there's such a cascade of you go from one autoimmune disease to another, to another, and to another, because you already have an overwhelmed system. And COVID-19, I put this in here as autoimmune because it's starting to look like it is becoming an autoimmune type of thing, like it's triggering. The vaccinations are triggering them, and the fact that you get COVID seems to be triggering. It has really, really increased in the last 2 years. And so they are now saying that there is, well, we already know there's an immune component. We already know that there's a blood vascular component to it. And there's 3 different stages that we usually treat in helping, but we also have to be on top of it. There is a website called T-Detect. The best way to determine whether you have antibodies against COVID, and it's not antibodies. Antibodies are not a good indicator unless you're looking for the autoantibodies. It is the T helper cells, because that's where your true immunity comes from. Antibodies are supposed to come in and then leave quickly, but it's the lymphocytes that, the T helper cells that make the long-term immune response. That's how you really know if you've gotten immunity to COVID. And that's the only company that I know that's doing that T cell test. Is T-Detect is what it's called. Okay. I'm not going to get into a lot more detail with that. So supported immunity. One thing you've got to do is you've got to eat a lot of vegetables and clean meats. What do I mean by clean meats? If you're eating meats that are raised with growth hormones and penicillin, a lot of antibiotics, it is disrupting your own immune system, and it's going to be hard to get your immune system under control. So you want to eat organic, pasture raised. Nobody's done anything nasty to their system, so it doesn't do anything bad to yours. Garlic, ginger, onion, turmeric. There's lots of different foods to add to support your immune system. All of these help to strengthen, not stimulate. Okay. There's a lot of different immune booster herbs, and I believe that there's some toward the end here, but we've got to move through to get to it. Eliminate worthless health depleting foods. In other words, stay away from your junk foods, stay away from your fast foods, because they degrade that. And one of the ways that they do, they all use bad fats. Fats are an integral part of your immune system. Your immune cells are actually made primarily of fats. When you eat bad fats like hydrogenated, partially hydrogenated canola oil, soy oil, corn oil, some other big ones in there, any of the vegetable oils, they actually interfere with the immune process. There's a cascading of immune events that have to happen. And when you eat a bad oil, it gets in the middle of it and it stops it from progressing. So when you eat things like hydrogenated fats, it takes 600 days to get out of your body. So you have to stop as soon as you can. And anytime you eat out, 97 point something % of the oils are liquid margarine that they're using. So what I usually recommend people do is that when you're going to eat out, tell them, please cook my food in butter or coconut oil or olive oil, and please don't use your traditional oils. And hopefully they will. So try to control it as much as you possibly can. Pancreas. That is another thing that we're having more and more autoimmune. I mean, diabetes is now considered an autoimmune disease, and there's more pancreatic issues that are coming up. They're usually insulted. What causes pancreas issues is injury, infection, gallstones, excess carbohydrates and sugar consumption, as well as alcohol consumption. And diabetes, of course, is a topic all of its own. In fact, we do a class just on blood sugar issues. It says that in type 1 or juvenile diabetes, the autoimmune disease occurs through T-cell mediated destruction of insulin-producing cells of the pancreas. So we have a cleanse for that. We have all kinds of ways that we can support pancreas health, including pancreatrophin PMG, which again is another PMG, another protomorphogen. Paraplex also has protomorphogen in it, but Paraplex has adrenal, thyroid, pituitary, and pancreas. All of those are helpful in the whole blood sugar mechanism, all PMGs. Bone marrow produces about 500 billion cells a day, and it is also a component of your lymphatic system and is part of your immune support. And now they're finding that, we already knew rheumatoid arthritis. I think that was probably the first truly identified autoimmune disease. But we're finding that it's not just in rheumatoid arthritis, but in osteoarthritis. So they're finding autoimmune antibodies against cartilage, which we've known, but now also in osteopontin, which is affects osteoarthritis, not just rheumatoid. There's another one in here that'll clarify that a little bit better. This one, autoantibodies in osteoarthritis. I think there's a couple. And autoantibodies to osteopontin in patients with osteoarthritis and rheumatoid arthritis. Their data showed that OPN, which is the osteopontin, is one of the autoantigens in both osteoarthritis and rheumatoid arthritis. I don't want to get into detail on this, but your bone marrow is part of your immune system. So if you're having problems with your bone, you've got an autoimmune issue going on that's also affecting the immune system. So I want to make sure we cover what to do here. So bone broth is wonderful for your bones. It's wonderful for your entire body. How many of you drink bone broth? Okay, so good. A good 60, 65%, maybe 70% of the class. That's fabulous. When I used to teach about this, you couldn't buy it. You had to make it. I still believe it's better to make it. But at least it's getting easier to access and easier for people that don't have the time or don't have the resources to be able to make it. This is my recommendations. It is a 4-day process because in 4 days you get more minerals than what you get when they just do the quick processes that you're getting, prepackaged. If you have an autoimmune disease, I usually recommend people drink 1 or 2 cups of it a day.
Is there any way to make it taste better?
Number one, put salt in it. Yes, salt actually helps it get into your system better. And it's
Colored salt.
colored salt. Yes. It actually completely transforms it when you have salt versus not having it. So, and chicken broth tastes better than bone broth. Bone broth is harder for most people. Beef. Yeah. What I say, beef, bone, beef broth. So chicken is more palatable for most people. And until you get used to it, you can always dilute it a little bit until you get more used to it, but definitely put salt in it and make sure it's a good quality salt. So the intestines is something else that we have to really be careful with because more and more people are having autoimmune diseases in the intestines because of gluten and soy and genetically modified foods, processed foods. Coffee, sugar, and other acids are horrible on the gut, will just tear your gut up. Antibiotics, of course, we all pretty much know how bad antibiotics are, and not enough healthy flora can all affect your intestines. I wanted to show you, I think this blows up a little. Oh, shoot. It's not connected. Oh, maybe it is. I don't think it's, I don't have time to go through and do this, but basically let me see, I have an image so we can bypass it. So this was these first two were really good pictures that showed how the microvilli in the intestines flow and push nutrients. And the other one shows some damage in it. Both of them show damage. You can see a little bit of the damage, in the red area there where it's inflamed. But cilia are found on ciliated epithelial cells. In the lungs, it's also found, no. I guess it's mostly lungs and intestines. I was thinking of something else. It's kind of like a sea anemone. Have you ever had that? How they kind of wave in the water and they catch nutrients and they pull it into themselves. It's kind of how they work. You can see a little bit here. This is normal. The image on the left is the normal microvilli. They're nice and big and they wavy. But when they get destroyed, if you look at the image there on the right, that's celiac disease. You could see it's like all the cilia were just kind of chopped down to nothing. Coffee also does that, chops them down so that you get these little nubs that are trying to push nutrients instead of this nice wave-like. You just got, little nubs trying to push things through. There's different things that we can do to repair it. We have to have pre and probiotics, not just probiotics. They have to be together. Probiotics is the bacteria, the flora that helps build your own flora. The prebiotics is the food that feeds them so they colonize and stay in their system. Without the prebiotics, they just go out as soon as you go to the bathroom. If you want them to stay and colonize in your gut, all these good probiotics, you have to have the prebiotics to feed them. Does that make sense? So you need both of them. There's lots of different tools. Ochrapepsin E3 is something that we use to degum when the microvilli gets gummed up by gluten and too much gooey foods. It helps to degum it and pull it out and put a coating that heals the tissue and protects it at the same time. Dermatrophin is a PMG again that helps take the immune system away from the damaged gut so that we can heal that gut tissue. So I just talked about that. I don't think we need to go through that more. The PMG for the gut is dermatrophin, and ochrapepsin I already talked about. I forgot I had slides on it. So digestive health in general, you will never get rid of an autoimmune disease if you don't correct your digestion. If you're not producing the enzymes that are needed to break down the nutrients that you need to heal, you will never get it under control. Okay? So keeps your proper pH. One of the lines of defense against viral and bacterial and parasitic and yeast and fungus and mold in your gut is hydrochloric acid. The reason why it's so acid, it's almost equivalent to battery acid, but it's buffered, is one of its job is to kill those things off before it gets into your system. So if you don't have enough digestive enzymes and you're taking digestive, acid suppressants, you'll never get well because you're not able to get those nutrients. And because it's not protecting you from the new stuff that you're eating and killing it off. So skin, lungs, and mucous membranes all are potentially, this is a picture. I don't know if that's going to show either. Oh, shoot. It just shows cilia, and cilia is in the lungs and the mucous membranes. And that job, the cilia in your sinuses is what carries all the stuff from the air out. That's what mucus is for. And for a lot of people, it gets gummed up. And dairy products and gluten are the two biggest things that'll gum up your sinuses from cleaning out what it's supposed to. We also have a 10-day sinus health protocol. Hormones are really, really important in balancing when you have an autoimmune disorder. So if you're having hot flashes or you're having PMS or you're having different hormonal issues from that standpoint, that has to also get addressed because hormones are your chemical messengers. This chart and that chart right there show all of the organs and glands that produce a hormone. And as you can see in this chart, it's dynamic. It's always moving. It is this, if one function goes down, everybody else has to adjust to that. If another function goes down, everybody has to adjust. If something's overactive, like let's say the thyroid, everybody else has got to downregulate. They're always changing and moving in the hormonal system. And when we talk about hormones, it's not just your sex hormones. It's your happy hormones in your brain. It's your pain hormones. It's your anti-inflammatory hormones. If they're not balanced, you're going to be in more pain and more inflammation if you don't get that handled. So prostate cancer, autoantibody signatures in prostate cancer. It's been known for some time that patients with cancer produce antibodies against the antigens in their tumors. They were able to show that looking for autoantibodies are a better indicator of prostate cancer than the PSA test. Again, we've got a prostate protomorphogen also. Autonuclear antibodies in women with silicone breast implants. This is one of the problems. A lot of women are ending up with chronic fatigue syndrome or encephalopathy because of the autoimmune response to the silicone breast implants. And we have mammary PMG for that and also some hormonal detox. We also have an inflammation detox that you can do. Because the more you can, what I like about this 10-day healthy inflammation program is it is an inflammatory purge. So what happens in autoimmune disease is you have a lot of inflammation in your body, right? And inflammation is okay. Inflammation is good because it's part of the healing process, but it also gets too much and you end up with runaway inflammation. And as long as you do that, now you're burdening your immune system even more. So to get in and just kind of do this sudden purge of inflammation really gives your immune system a little jump start to be able to handle things. We were talking about protomorphogens. There's a protomorphogen for almost every organ and gland in the body. And I use this. I don't think a day goes by that I don't have somebody on a protomorphogen because there are so many autoimmune diseases or issues where their body isn't functioning like it's supposed to. And like I said, it gives like that DNA blueprint that says, okay, this is what you're supposed to be doing. And so we use these quite a bit in practice, and Standard Process is the only company that makes them. We have combination products like for men, Simplex M, that has several different that help with that. Women and blood pressure. The difference in all three of these is just the top one, but they all have thyroid, pituitary, and adrenal protomorphogens in addition to whatever else it is that they need. The other thing that helps with autoimmune diseases is acupuncture. Acupuncture helps to restore organ function, stimulates the healing of tissues, regulates the immune system, decreases inflammation, decreases pain. That should be on there too. Reduces the effect of stress on the body. Is also relaxing. Then in one of the things that acupuncture also addresses is what's referred to as immune gates in Oriental medicine. The immune gates is the back of the neck and the kidney area. In China, when there is cold, when there is wind, or it is a cold day, you never see anybody without a neck scarf and they wrap. When I studied in China, they would take a piece of flannel and wrap it around and around and around their kidneys in the winter to keep them warm. And they found that when they did that and when they kept their neck protected from wind and cold, that also strengthened their immune system. They call it immune gates. And acupuncture also stimulates those and makes them stronger as well. And so we think of only winter, but if you're sitting under air conditioning and it's hitting your immune gate, that's also going to be affecting you. So remember about that as well. So handling, there's a couple things that I didn't talk about that I didn't see in here that I really wanted to talk about. And one is, we talked a little bit about fats. You have to have fats in your diet if you're going to be able to recover your immune system. Bottom line, the only fats you should consume is olive oil, coconut oil, butter, as long as you're not allergic to dairy, and lard or tallow. Okay? Lard. Remember lard?
I thought lard was bad for you.
Nope. It has been demonized for about 7 decades. And now they find it's one of the most important. All of your saturated fats are needed more than any other kind of fat in your body because you need them for brain cells. You need them for your immune system. You need it for tissue repair. You need it for a lot of things. So at one time we thought it was bad. Now there is a caveat on that. And that is it has to be clean. The antibiotics and the growth hormones that they give to pigs and to cows store in the fat. So if you're going to eat lard, you've got to eat it clean. You've got to make sure it's from pasture-raised animals. It is organic. They have not been feeding them growth hormones or antibiotics or anything else like that. Okay. You need to make sure that you're eating a lot of vegetables because you've got to get the minerals. You need to eat good quality protein, and some of that protein needs to be raw protein. It shouldn't all be cooked protein because there's 21 to 22 functional amino acids, depending on who considers what functional. And of those, 13 are destroyed by heat. If the only protein you ever eat is cooked protein, then you're never getting those amino acids. And they're very critical for brain function. They're critical for hormones, and they're critical for your immune system. So raw nuts and seeds like pumpkin seeds or sesame seeds or sunflower seeds. Sesame seeds, by the way, are one of the healthiest foods when it comes to calcium. Okay, as long as they're hulled and as long as they're nitrogen packed, so they don't go rancid, because they go rancid very easily. The other forms is traditionally in our diet, we've always had raw protein. In ancient times, it was always in raw yogurt and raw milk products, but most people only eat pasteurized. So you can get raw protein in drinking raw milk and especially in raw cheese. But if you're going to use raw cheese, don't cook with it. If you're going to cook it and melt it, you might as well use the garbage, pasteurized stuff. Don't ruin your good cheese by melting it. Okay. It only takes 140 degrees to kill the enzymes, and you've turned your raw cheese into pasteurized anyway. So another source is raw eggs. And that gets people kind of scared because they're worried about salmonella. Salmonella has never been found in cage-free animals, truly cage-free. And I don't mean like sometimes they say there's a little door on a factory of thousands of birds, and if you find their way out, then they can go out and be out in the grass. They say that's cage-free or get grass-fed, but I mean truly like local eggs. Salmonella is destroyed by warm, soapy water. And it's never inside the egg, it's only on the shell. So I tell people if you're going to have raw egg, make sure that you wash the eggshell in warm soapy water and you get local farm eggs. Okay. It is one of the most healing thing you can do is put raw eggs in your diet. Some people put it in a smoothie. Some people put it in their oatmeal. If you put it in your oatmeal, wait till it's off the stove and then put it in. It makes it nice and creamy. You can't taste it. And it's a great way to do that. Another thing that used to be in our diet is things like steak tartare, where there was preserved raw meat. And that's harder for most people, although, in the 40s and 50s, it was very popular. And more restaurants are starting to reintroduce that. So that's another way to get your raw meats or raw proteins. I think that's most of the sources for that. So treating autoimmune diseases, as you probably realize, is complex. And it's not really a simple process. You have to be eating the right foods. You've got to stop eating the bad foods. You've got to detoxify in the right timing. But I have to tell you that even though it's complex and it's better to handle it with somebody who is used to handling this kind of thing and taking it from all the different perspectives, but every little thing that you do that we learned tonight is going to make a difference. If you stop inflammatory foods, which we didn't quite talk about, like gluten or dairy, if you're allergic to it, some people, it's your nightshade family, like tomatoes, potatoes, eggplants, and peppers. Taking inflammatory foods out of your diet is going to make a difference. Doing an immune rotation is going to help. Eating good fats is going to help. Eliminating bad fats is going to help. Getting enough water intake so that you support your lymphatic system, or doing a rebounder. Each little thing that you can add is going to help your condition, and just address it, period. Just address it. All the different things that is stressing your system out. Every symptom that you can, it's better to address it and address it as a whole. And I was hoping we'd have time for questions, but we're running 5 minutes over. So I will stay around if anybody else does have questions. And you're welcome to contact us. There's a number on the screen. Now there's a number on the screen. I just realized it was in the upcoming slide. So we use on the slide, since I missed it, we do a complete biofunctional analysis basically to find out the underlying reason why your body's not healing. We use health detective strategies to fit all the pieces together of what's going on with you. We use acupuncture. We use whole food supplements. We do 10 and 21 day detoxification programs. We do nutritional guidance. We help you with cooking ideas. There's lots of different things that we do to help. So I'm going to go ahead and end this session. And like I said, I will stay around for those of you that would like some additional help or questions answered.